This is Radio Health Journal. I'm Nancy Benson. This week, a rare genetic disease whose most deadly symptoms are often hidden.
And that's really the scariest and most critical issue that people with Marfan's will have.
Looking for hidden clues when Radio Health Journal continues.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Why should it be the case that somebody who earns $50,000 and has to work hard for it should pay taxes, but somebody who's given $50,000 or $50 million pays no taxes on it?
The policies that are only furthering the great wealth imbalance. Then,
we really don't value this job, even though it is so important to families and with our aging population.
The caregiver crisis in the U.S. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
One in 5,000 people worldwide are affected by Marfan Syndrome, a genetic disease often carrying visible symptoms like long arms, legs, and fingers, sunken chests, and excessive height. Star Wars actor Peter Mayhew, the man behind Chewbacca, was recognized for his towering thin stature. But not all cases of Marfan Syndrome are so obvious. The condition weakens the body's connective tissue, which anchors organs together and helps regulate growth and development. And that means Marfan Syndrome can be dangerous, causing fatal heart problems if a diagnosis is missed.
And that's really the scariest and most critical issue that people with Marfan's will have. That aorta will get bigger, it will lead to an aneurysm, and can have a aortic dissection where there's a tear in the wall of the blood vessel that often can lead to death if not either treated before it gets to the tear or basically urgently treated once it happens.
That's Dr. Gregory Perrins, professor of pediatrics at the UCLA Mattel Children's Hospital. He says unnatural growth of the aorta, the main blood vessel that transports blood from the heart, has become a key diagnostic characteristic of Marfan Syndrome. That is, if the unseen complication is caught in time.
Some people may have a very mild dilation and might not be affected until later in life. However, that is, yes, a key part of having Marfan syndrome, and of course it is hidden because the only way to know about that is to suspect this and to get images of the heart and the aorta with an special ultrasound called an echocardiogram.
While both the visible and invisible symptoms differ in severity for each patient, doctors often recommend avoiding exercises like heavy weightlifting and contact sports that stress the aorta. Blood pressure medications can treat the condition by slowing the enlargement of the artery. If these efforts fail, as Perrins says, people with Marfan syndrome often require surgery to prevent an aneurysm before they reach middle age.
Young adults, say up to age 30, there's an increasing percentage, but still relatively small, maybe roughly 10 or 20% who might need surgery. But by age 60 years, you're going to have, over 50% of people with the syndrome will have either had potentially a dissection or will require surgery for that because the aorta will be big enough.
But Marfan syndrome threatens more than just the cardiovascular system. It can also harm the connective tissues of the lungs, skin, and eyes. So what's the cause?
Marfan syndrome is a genetic inherited disease. It has a specific mutation in a gene called FBN1, and it affects a lot of the tissue that binds our body together.
That's Dr. Simon Fung, assistant professor of ophthalmology at UCLA. Through eye screenings, he helps diagnose obvious cases of Marfan syndrome, but also the less noticeable ones.
The skeleton is different. They have longer limbs and longer fingers. They may have some chest deformities from the bone standpoint, etc. And that would be like a typical appearance. Although I have seen in a few cases where children could present at a younger age, for example, in the 3-year-old and 5-year-olds, for example, and they do not necessarily have those features. What they can have, though, is the heart issues and the eye issues. And that's why we do a lot of eye screening for people who are suspected to have Marfan syndrome.
Impaired vision related to Marfan syndrome is commonly identified during a patient's teenage years. As children, people with Marfan syndrome may not realize they see the world differently than others. This symptom may be missed without early eye exams. For hidden cases, detailed exams with ophthalmologists like Dr. Fung can highlight specific changes, like blurry vision, pointing to Marfan syndrome.
The most classic change that people associate with Marfan syndrome is what we call ectopia lentis. And simply from the word, what it translates to is that the lens inside the eye is not in the right place. It's slightly displaced. This is because our lenses in our eyes, they act as a focusing mechanism and is suspended from the eyeball with these very fine cables. We talked about connective tissue being present in the eye, and these zonules are the very connective tissues that we were concerned about. And because there is some abnormality there, the zonules do not work as well as they should be.
But it's about more than just blurry vision. Marfan syndrome can pose a number of issues to a patient's eyes.
You can also have other more serious conditions, such as an early cataract formation. You can also have eye pressure problems called glaucoma. And one that is more common and also devastating is retinal damage, such as retinal tears or retinal detachment.
Treatment is possible with early detection when children experience refractive error. They'll need to wear very strong glasses.
Now, if we go into a more severe setting where we mentioned that the lenses may have had significant changes, it's moving too far from the center, and it's not centered and focusing the light anymore, then some eye surgery may be required.
If refractive error is identified in time and a child is given the correct type of glasses, they may be able to avoid corrective surgery down the road. But when it comes to surgery for the more severe cases,
typically what we've been doing has been trying to remove the lenses and then give either glasses or contact lenses for children to use. There has been some new developments, however, to try to save some of the natural tissue and put an artificial lens inside the eye so that the glasses and contact lens requirement will not be so strenuous.
Luckily, Perrin says that with appropriate care, people with Marfan syndrome can still live full lives with a normal life expectancy.
Some of it will depend on how severe their case is and how severely it affects their heart and arteries. And some of it will depend on the care they receive in terms of working up the aorta when it becomes enlarged, treating it, doing surgery when appropriate, and then following closely. So it's certainly possible, but it does often, especially in adulthood, require a lot of care and follow-up to get there.
As with most chronic illnesses, there is more to Marfan syndrome than meets the eye. To learn more about the work of Dr. Simon Fung and Dr. Gregory Perrins, you can visit uclahealth.org or find a link on our website, radiohealthjournal.org. Our writer this week is Scarlett O'Hara. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Pandemic school closures have taken a large toll on both children and their parents, socially, emotionally, and academically. But with prevention steps, including regular PCR-based COVID-19 testing, outbreaks in schools may be largely prevented. In fact, the Biden administration has identified testing in schools as a critical proactive step in recovery from the pandemic. Here's Shiraz Ladiwala, Senior Vice President of Business Transformation Projects, Thermo Fisher Scientific.
Testing for schools can be done accurately, efficiently, and affordably by using pooled PCR testing programs where multiple samples are tested at once. Batch results are reported as positive or negative and returned in 12 to 48 hours, helping to quickly indicate a potential outbreak.
Highly accurate COVID-19 testing helps school administrators detect outbreaks quickly, so informed decisions about in-person learning can be made. Find out more at thermofisher.com/COVID testing for schools.
Cardiovascular or CV disease is the #1 killer of adults in the U.S., and millions of people trying to reduce their risk of a heart attack or stroke may unknowingly be taking medications that are not proven nor FDA approved to reduce cardiovascular risk. Let's hear from cardiologist Dr. John Osborne.
Many people are unaware that after a failed outcome study, the FDA revoked the approval of fenofibrates when added to statins, as the risk outweighed the benefits to heart health. It's important to remember that statins, along with diet and exercise, can lower cardiovascular risk by about 25 to 35%, but persistent cardiovascular risk, which can lead to a life-threatening event, may remain. I would tell anyone still being prescribed fenofibrates, such as Tricor and Trilipix, with a statin, to talk to their doctor about FDA-approved therapies for cardiovascular risk reduction.
To learn more and get clear on the facts, visit itscleartomenow.com. Again, that's itscleartomenow.com.
COVID-19 vaccines are rolling out, and many Americans are looking forward to getting back to normal. However, chronic stress of the past year can impact memory, mood, and anxiety. So during June, Alzheimer's and Brain Awareness Month, the Alzheimer's Association reminds you to make brain health a priority. Beth Kallmeyer, Vice President of Care and Support for the Alzheimer's Association, has tips to restore mental well-being.
First, think about recommitting to brain-healthy basics, like regular exercise, a heart-healthy diet, and getting plenty of sleep. Try to unplug from technology every night. Do what you can to manage your own stress, especially if you're a caregiver for a person living with Alzheimer's or dementia. And return to normal at your own pace by taking small steps and setting boundaries.
Kallmeyer says it also helps the brain to help others by volunteering in your community. For example, by supporting the Alzheimer's Association's The Longest Day event, June 20th. Find out more about Alzheimer's and Brain Awareness Month at alz.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
As medical professionals, our first duty is to our patient, not the police or the laws. That's why I'm saying you would need a warrant from a judge if it's that important to you.
Police investigations in the emergency room.
Then, if you procrastinate, you might be avoiding something bigger than the task at hand.
Procrastination really is an emotion-focused coping strategy. It's not a time management problem, it's an emotion management problem.
All that and more on Radio Health Journal.